Okay, we're live now.
Hey everyone, welcome back to another session. Today we have Dr. Adams. He's an endodontist, and he'll be sharing his journey along with any tips and just his journey throughout dentistry. So take it away, Dr. Adams.
Awesome. Thank y'all so much. This is a really cool organization. I know the pandemic has affected a lot of, pre-dental students' ability to be able to do in-person job shadowing. And so I'm honored to be asked to participate. I think this is a really neat platform. So again, my name is Dr. Michael Adams, and I'm an endodontist. So I'm sure you've had a lot of great professionals on here already. So what I'm going to try to do today, though, is provide a little glimpse of what it is like to work as an endodontist. And right off the bat, I mean, who in the world cares? I think hopefully what you get from this presentation is the ability to visualize what the profession looks like kind of in day-to-day life. Because when you can visualize something, you can better, picture it for yourself and know if it's something you might be interested in or not. Sometimes issues are just a process of elimination. And even if you come away from this knowing that you don't want to do endodontics, then that's, I think, still valuable. And there are really niches in dentistry for everybody. So today, what I would like to discuss is just a little bit of a personal background, because that's what I know best, my story of getting into endodontics. I'm going to go through my college experience and then also talking about gap year and then dental school on into residency. And then we'll actually kind of dive into what endodontics is and talk about, some statistics, what an average salary or income might be, some of the types of cases we need to treat, and then show you some pictures of the office that I work in. So before we start, I just want to make sure audio is good and everything is looking okay.
Yep, perfect.
Okay, awesome. I guess before I dive in here, my girlfriend is a medical neurology resident, and I'm going to be kind of toggling between two computers because I need to see some notes. But she may come and take the other computer I'm working with because she's on call tonight. And so if that happens, I'll just kind of be ad-libbing a little bit, but that will be fine if we need to do that.
It's all good. Thank you.
Okay. So I'm not going to spend a whole lot of time talking about college. I'm sure you've had a lot of people, come and talk about what it means to be pre-dental and what you can do in order to create a great resume or CV to become a desirable candidate for dental school. But just briefly, some of my college background was I'm actually from Nebraska, and I know this platform actually has a global audience. So for those of you who don't know, Nebraska is in the middle of the United States. And so that little dot there in the middle of the map on the bottom picture, that's where I grew up and I went to college. And then I currently live in Birmingham, Alabama, and that is the other heart-shaped dot down on the lower right side of that picture. So when I went to college, it was 2008 to 2012. I did major in biology. I thought a science degree would probably have the best shot at getting me to where I wanted to go after college. And I had a pretty good GPA. I studied hard. I actually thought initially I wanted to do medicine. And so I knew GPA had to be really high. I decided to take the DAT actually my fourth year of college because I knew I was going to have a gap year. But normally you take it the third year. And I got a 19 when I took it. It's not a really impressive score. It's actually relatively average. So to stand out as a more desirable candidate, you really should probably try to get a DAT score of 20 or 21. But luckily, my GPA was pretty good, and I was able to get into the University of Nebraska College of Dentistry. I think it would be a good idea to take a prep course for the DAT. I did not. I just kind of took it using my study materials from college. Um, so that's kind of how things went for me. I studied really hard, and it did take a lot out of me, and so that's why I decided to actually take a gap year. And in a lot of ways, this was my favorite year of life. I couldn't recommend it enough, actually. It just allowed me a little bit of time before diving right into dental school in order to just decompress and do some things that I had always wanted to do. I got to do some traveling. I worked different jobs that I'd always wanted to try. I worked as a phlebotomist, drawing blood at a hospital, worked at a food truck, and played in a band, and just kind of enjoyed life before really committing to the long process that is a professional degree in dental school. So I stayed in Nebraska for dental school. This was a picture of my classmates and I on our graduation day, and of Kayla and I, that's my girlfriend. And I was not really a stellar dental student in terms of GPA. A lot of people think, maybe oral surgery or orthodontics or endodontics, you have to be in the top 10% of your class. I was actually in the very middle of my class. Something that I did show, though, was improvement every year, and I think that went a long way. But I really did not start off very strong, but slowly got to a point where I actually ended up in the middle of my class. And endodontics or other dental specialties are still accessible, even if you are kind of in that position. I think genuine interest and building a CV or resume that shows you are interested just really goes a long way. So don't let like your class rank or your GPA be a limiting factor in really going for what you truly are interested in. In dental school, yeah.
Hi, Dr. I'm sorry, I was going to interrupt you a little just to ask a question.
Absolutely, yeah.
Okay, so this actually goes back to your previous side, a little bit of a gap year. I just wanted to talk about it a little bit. So before going into your gap year, did you know that that was what you wanted to do, and did you plan out your gap year, or was it more of like something that was spontaneous for you, or how did you approach your gap year?
No, that's a great question. I'm glad you asked that. So, like I said before, I was actually interested in medicine, and so I didn't actually decide that I wanted to pursue dentistry until the end, I would say, of my third year. And that was already a little bit late. I was kind of almost at the point where I was having to decide, okay, am I going to take the MCAT or am I taking the DAT? And so because it was a little later, I just decided to relieve some pressure on myself, and I actually planned out the gap year. And what that did for me was allow a little more time to actually prepare for the DAT and just kind of I guess just give me a little bit of breathing room. And I'm really glad that I did it. I'm really, really happy I did it. I had approached college knowing that I wanted to do something healthcare. I thought it would be medicine. So, I mean, if someone doesn't know what they really want to do going into college, it's almost smarter to take a gap year before college, in my opinion. But in my case, I kind of had already done all the hard work of getting the college degree, but then I was able to just have a little bit of a fun year, before committing to a career. Because once you get in and you have all the loans and you have all the studying and you've invested a lot, and then you have to kind of you need to work in it. And so it was a good idea for me. It may not be for everybody, but.
So he's going to digress a little bit. You said a couple of times already that you were pre-health or pre-med at first, and then you were deciding between the MCAT and the DAT. Did you have like a specific thing that pushed you towards going down the pre-dental route over the MCAT route that you kind of like discussed probably in your personal statements or anything like that?
Yeah, so that's why I think this kind of platform is so cool, this virtual shadowing,
Mhm,
because when I was actually able to visualize what it meant to work in dentistry, when I
mhm,
saw it in person for the first time, um, that sealed the deal for me. And so,
mhm,
that's why these kind of things I think are just great. And I also, before I had kind of been able to visualize dentistry, I had done a lot of shadowing in medicine. I shadowed a lot of different
mhm.
physicians and different types of things that I thought maybe would be interesting. And there were actually a couple physicians who maybe encouraged me to not go into medicine. And so,
Oh my god, wow.
yeah, and I'm actually thankful. I'm thankful that they were honest with me because I truly think that dentistry was a better fit for me. And so,
Mhm.
that's very nice of them. They could have, painted a picture of it being perfect, but they were real with me. And as soon as I could visualize it and I turned my attention to dentistry, I knew that it was for me.
Well, your story sounds a little similar to mine in that aspect
Oh,
too.
cool, cool,
Yeah,
awesome.
so
I love that.
yeah, it was kind of reassuring to hear.
Yeah, that's
Okay,
awesome.
and then moving on to some questions about dental school. Did you know that you wanted to stay in Nebraska for dental school, or was that just kind of like, oh, it ended up that the school accepted me, and that's why I went here?
So I was accepted to Nebraska and to Loma Linda University
Mm.
out in Southern California. And
Ah.
the reason I chose to stay was because I was an in-state resident, and
Mhm.
so
Mhm.
that was the tuition was a lot different compared to a private institution.
Totally agree. Yeah.
Yeah.
Okay. And then through your experience, how much did a class rank matter during dental school? Do you think school residency programs look very into it nowadays, right now, or has it gotten more competitive, etc.?
Yeah. So it seemingly, from what I'm hearing, actually class rank and GPA, some are going to more of a pass fail system,
Mhm. Yeah.
and so it it's actually more important to be building showing your true interest through your extracurriculars, outside of
Mm.
your actual grades, because it's getting harder and harder for residency programs to differentiate between who is
Yeah.
kind of, the top of the class and who wasn't, when
Mhm.
everyone's going to a pass fail system. I think we're kind of in
Mm.
that middle ground still right now where it's not everyone's on the same page with that, but I'm just hearing more and more everyone is going pass fail. So what I would
Uh-huh.
say is it shouldn't be a limiting factor for anyone.
Mhm.
If they're truly interested in a specialty, there's ways to go about it, to kind of set yourself up for being a desirable candidate without
Mhm.
being in the top 10%. It obviously always helps. It always
Yeah.
helps. So I say do the best you can.
Good
Yeah,
advice. Thank you.
yeah.
Okay. And then at your time at the College of Dentistry in Nebraska, uh, did you specifically like anything about your program that you want to share, or something that stood out about the program that that you enjoyed?
So you can see that was everybody in my class in that bottom picture right there. It's a smaller school. So I mean, Harvard is really small. I think Mississippi has a pretty small school, but Nebraska is like in the bot like one of the five smallest class sizes, and so there's a really good teacher to student ratio, and you really get a lot of attention. And I think that's a great thing about Nebraska.
Yeah, something I'm looking forward to. Yeah.
Yeah, I mean, some places really big, and you kind of can get
Hmm.
lost in the mix a little more.
I getcha. Yeah. One thing I'm a little afraid of, but yes, you can continue. Sorry for interrupting.
Yeah, no, that's a great question. I love it when it's kind of like right,
Back
right,
and
kind of
forth.
along as we're going through. Yeah, yeah, that's
Hmm.
perfect. So
Gotcha.
I'm gonna kind of skip on to how someone, if they are interested in endodontics, can just build a CV to show their interest. I think first and foremost, it's important to cultivate good relationships with your instructors. Okay, because you have to have great letters of recommendation. down the road in order to get into a residency program. And the best letters come from your actual instructors in that specialty. So that's one thing to consider. Another thing you can do is become a student member of the AAE, which is kind of the premier association, professional organization here for endodontics in the United States. And it's pretty cheap. It's only like $75 or $100 for a year. And it's just something good to add onto the resume. Another thing I did, because I knew by my second year of dental school that I was interested in endo, was I went to the endo director and I asked, hey, can I help some of your residents with their research? And I actually was able to get my name on some of their research and it showed that I was interested. I think that was a good thing. Now, not every dental school has a residency. So, this is just if you happen to have one, but that's a good thing to do. And then every dental student that I know of in the United States is required to do some type of dental school research. And I decided to choose a topic related to endodontics just to show my interest in that as well. And then I know that it's been difficult to travel because of the pandemic. So, students who are in dental school right now, they might have a harder time with some of this. But if you can attend the AAE annual meeting, it's always in April. I was able to meet a lot of program directors and do a little bit of networking. And I think that is a beneficial thing as well. So beyond class rank and GPA, those are some things you could consider. So I got out of dental school and I knew that I wanted to try to do endo. I applied. I did not get in, right out of dental school. And I think that's actually very common. Endodontics requires a strong working knowledge of restorative dentistry because you are one of the specialists that is helping determine whether a tooth should be saved or not. And so a lot of programs actually like applicants that have some private practice experience or have a GPR, like a 1-year general dental residency. That's usually the most common type of applicant that is accepted into endodontics. So I worked for a year in private practice and I went to Wichita, and these are some pictures of the office I worked in. And during that year, I interviewed and then was accepted into residency. So there are 55 residencies for endodontics in the United States. Most are 2-year programs. There are some that are 3 years. They usually have a little bit of a stronger research basis. I got accepted into the residency that's in part of the University of Tennessee, and that's in Memphis. And what I got from the program was a certificate allowing me to say, hey, I can do root canals. And then we also did some research that allowed me to get a master's degree as well. And these are my co-residents at the bottom right. A lot of programs are really just between 2 to 4 applicants. So pretty small.
Okay, I do have a couple of questions before you go.
Yeah, sure.
Okay. And then, okay. So first, we were thinking of asking for research. Were you specifically ever interested in research? Was research kind of your route, or is research just naturally a part of dental school and residency that most students would need to go through?
So it is part of most dental schools, and it is part of most residencies. Now, some will kind of make you do a project of some kind, but you may not get like a master's for doing it in residency.
I see.
Every dental school I know of has students, find a faculty mentor and do some kind of project. And every residency that I know of, at least in endodontics, does the same thing, but some don't give you a master's.
I see. Okay.
Yeah, and it is not something that I actually am energized by or really enjoy doing. It's just kind of part of what I had to do. I like the clinical work a lot better.
I see. And then you mentioned on the last slide you were saying that you were invited to meetings and that you got to network through some meetings. Where like was some resources that you could find out about different organizations and readings, or were those resources provided to you once you arrived at dental school?
No, they're not provided.
Um,
There are all kinds of, I mean, every dental specialty has an official organization, at least in the United
mhm,
States, and most all of them will have a meeting every year. So whatever,
I see. Mhm,
residency you're interested in, you can probably, find that organization's main page and then figure out when the next meeting is.
mhm,
Relatively
okay,
easy. Yeah.
mhm.
For
And
endo,
then
it's always
yeah,
in April. Yeah, it's always
April.
in April. Yeah.
And then this meeting is for like graduate students. It's not like open to perspective like pre-dentals or anything like that, right?
It's open to anyone who has a membership with that
Mm,
organization. So
I
not
see.
anyone can go. You do have to be a member, but to be a student
Mhm,
member, like if you're in dental school, it's pretty cheap. It's only
I see.
75, $100 maybe. Um,
Mhm,
it's usually like a Wednesday to Saturday, and
mhm.
you don't have to go the whole time. Yeah, like
It's just
some of those times I actually just went for 2 nights.
yeah, back.
So yeah,
Okay.
it was something that pre-pandemic it was beneficial, I think, because you got to talk to others about, oh, what is this program like, or oh, where are you trying to go? Because as a really you don't know like what the
Mhm.
culture is like in other places. It's beneficial to make friends, make contacts that you can then talk to down the road, to figure out more information about,
Of course,
like,
yeah.
yeah, it's just beneficial.
Mhm. Okay, and then was there something in dental school that made you know you want to go down endodontics, or that was something what would you say to students that are interested in endodontics and want to like get that step ahead if they could? Any advice in that area?
Yeah, that's a good question. So the first question was, how did I know I kind of wanted to do it?
Mhm.
um, I knew from, I know this is weird, but I knew from the very first lecture on the dental pulp that I had in second year of dental school. I just kind of knew that I was interested in it. And
Um,
then also, you usually have a lab class that's associated with it,
mhm.
just like you do in college. You have
Yeah.
lecture and then you have like your lab. Well,
Mhm.
it's the same. It's the same. With this. And from the very first time that I got the instruments and we had fake plastic tooth,
Mhm.
go through all the steps of like doing a root canal, I
Mhm.
just knew that I liked it, and I hadn't had that feeling with anything else. It was the first class after the first lecture that I actually went back and I wanted to read the textbook. And that may be bad to say out loud, but you go through so many things just because you have to learn it and know it. But
I
this was
get
one
you.
I actually wanted. I actually wanted
The
to
passion
learn
was
about
real.
that. Yeah, yeah,
Okay, and then my final question I have for you right now is, so you mentioned that you went into private practice before you went into endodontics. Did you do a general residency before going into private practice, or you just went straight into private practice and only did the residency for endodontics?
So that's a good question. I applied for several 1 year fellowships in general dentistry. There's two types.
Hmm.
One is called an AEGD, an Advanced Educational Degree in General Dentistry, or something like that. And
Yeah.
then the other one is GPR, General Practice Residency. For whatever reason, endo directors usually like GPRs more. Okay.
Okay.
So I did apply to a mixture of both of those, and I
Hmm.
actually had an offer to go a couple different places, but I compared it to some private practice offers I had, and of
Hmm.
course you make a little more money in private
Hmm.
practice, and just it seemed like the right option for me to go into private practice because I knew I was going to get a lot of experience anyways, and just weighing all of the options, where the programs were, and
Yeah.
where I wanted to be. It just made sense for me to do a year in private practice.
That makes sense. Okay, I see. So it's very circumstantial too sometimes.
Yeah. I mean, I definitely explored it, and I went through the process of interviewing and everything, and then I just kind of weighed all of the options.
I see. Okay. Thank you.
Yeah, absolutely. So now that we've kind of covered like the educational process of getting into it, well, I'm going to be honest with you. When I started dental school, I did not actually know what a root canal was. I didn't. So this is, some of y'all will probably already know this, but endodontics is the specialty of dentistry concerned with diseases and injuries of the soft tissues inside the tooth, which is called the dental pulp. And so there's a graphic here on the screen, right? You see a cavity in the middle of this tooth. And of course, cavities are formed by bacteria secreting acid. And so that cavity can allow bacteria down into this pulp tissue of the tooth. And that can cause a bunch of inflammation. And if that inflammation goes on long enough, it can turn into an abscess. And this infection, that type of inflammation and infection of that pulp space, it can result in something called apicoeperiodontitis. All that means is the apex of the tooth is the end of the roots of the tooth, and that space can become really inflamed and painful to pressure. Okay, and the tooth can really hurt with hot and cold. And then if it goes long enough, all the tissue inside of the tooth, it may die. It may turn into an abscess. And if that happens, then the treatment options actually are pretty straightforward. Okay, it can either be the tooth can be extracted, or you can try to save it. And so endodontics, we're here to try to save teeth that have enough tooth left to save, and they don't have big old cracks going all the way down the roots. And if the patient wants to save it, then the root canal needs to be done, and then the tooth can be rebuilt back up, and you can put a crown on it. So endodontists are specialists in saving teeth, and we're very proud of that. There are about 200,000 dentists in the United States, and there's only about between 5,000 and 6,000 practicing endodontists. So that means only like less than 3% of dentists are endodontists. There's no way that endodontists could do all the root canals for dental patients. Okay, most root canals are done by general dentists, but there are cases where it's tougher to do, or the patient might be a little more difficult to manage, or maybe a dentist just doesn't like to do root canals, and that's totally fine. But so we're here to help with the more complex cases, and that's kind of our role in the whole field of dentistry. A lot of dentists do not like doing root canals. It's not really a super glamorous thing in dentistry. It's not, as flashy and cool as like ortho, like doing braces and making beautiful smiles and doing aesthetic dentistry. It's actually hard. It's hard work, and it's really detailed work. And so because it's kind of hard and people don't like doing it, you are compensated well. And an average salary is probably between $200,000 or $300,000 per year. Of course, that differs depending on what state you live in, where you go, if you're part owner of the practice or not, if you're just an associate like myself. So of course there's a lot of variables with that, but you are compensated well for the work that you do. Some common characteristics of people that go into endodontics, and this is kind of my opinion. Okay, this isn't objective at all. This is just me trying to help whoever's listening know kind of the type of people that go into this, just in general. I think it's really important to have a genuine interest and curiosity about endodontics. If you're doing it just for the money, I don't think you'd really be that happy doing it, because it can be hard work. It can be hard to do it. I really enjoy longer procedures and seeing fewer patients in a day. When I was a general dentist, I would get a very full schedule, and I would constantly be pulled away to do a hygiene check right when I was starting to enjoy the work that I was doing. And so I knew from even just that 1 year experience that I really wanted to get into something where I could do longer procedures on patients and see less patients per day. I am actually a little more introverted, And when you're doing root canals, you put a rubber dam in the patient's mouth, okay? And you kind of just get to work. And of course, you need to still, build rapport with your patients and, try to explain everything really well. And but I found that the social aspect of being in a very busy general practice was actually really draining for me just because of my personality, because I am a little more introverted. I think perfectionistic and detail oriented people do really well in endodontics because it's really fine work. Like we work in fractions of millimeters when we're talking about like measurements for the length of roots of teeth. And so those characteristics I think are helpful. And lastly, we do kind of have, I think we have a perception of being extra nerdy, kind of weird oddball type people. And I actually like that, but it is what it is. I'll take it.
And before we see the next slide, since you guys are working and doing a really hard job, do you ever feel like physical fatigue or soreness from your body? Is it a common occurrence, or how do you help with it if you do experience it?
I would say it's a lot better than other areas of dentistry, in my opinion. And the reason why, which you'll see some pictures of it, at the very end of the presentation, but is we work through a microscope. So you're not really bent over, looking into a patient's mouth quite as much as you are if you wear loops. I think that the posture is better, but the problem is the procedures are so long that sometimes you do get stuck in chronic positions for like a longer time. So I don't think it's quite as bad, to be honest, as other areas of dentistry comparatively, but sometimes like I'll feel like my neck and my back is still really, really stiff. But that's really it.
Oh, I was surprised to hear. Okay, that's cool.
Yeah. Are we good to keep going?
Yes, we could keep going. Yeah.
Awesome, cool. Okay. So we kind of talked about this a little bit earlier, but just I introduced endodontics previously. I know it's the same graphic, but again, here's what really happens. So bacteria, when it infects the tooth, it can get in from cavities, which is called dental caries. That's the correct word for it. Cracks can allow bacteria into teeth as well, and trauma can actually impact teeth enough that the tissue dies and bacteria can get into teeth from that. When that happens, there's a host immune response, which causes a bunch of inflammation. And when it's inside of a tooth, it's a hard, bony, enclosed space. And the inflammation causes pressure increases, and that pressure can really hurt the nerve inside of the tooth. And so possible patient symptoms can include lingering aching pain with hot or cold liquids, for example. And if that inflammation spreads to the ligament that holds the tooth in the socket, it can also, the tooth can become tender to chewing and biting. And sometimes, though, all of this is happening, but for whatever reason, the host response, the patient's immune response, is not significant enough to really help them have any symptoms. And so sometimes we do catch these things just based off of x-rays. And we can see what needs to be done just sometimes from that. So we're going to dive into just some procedures. Here's a list of the procedures that are performed. Most of our treatment is actually composed of the top two. Okay, so initial root canal treatments or root canal retreatments. And I do have some cases that I'll just show here. Here's a little graphic showing, a cavity that infected the tooth, and then it's happening really fast here. But what happens is, okay, there's a cavity affects, you got to clean up the cavity, and you measure the roots, you disinfect, and then you seal the roots up with this orange material and some sealer. And then after that, the tooth is ready for a buildup and crown. And here is a case that I did. It was a lower molar on the lower right side. In the very back on this upper left x-ray, you can see a big cavity in the top of that tooth, right? And then dark space in the middle, that's where the nerve typically is. And it had been there long enough that a little infection had started at the end of the root. You can see the dark space at the end of the root right there. And so then we cleaned up the cavity and got all the nasty tissue out of there. And then you can see the bottom left picture is me fitting some little pieces of filler material down into the roots called gutta percha. And then after we make sure everything's fitted nicely, we actually take those pieces of filler out. We dry the canals. We put some sealer down in there. We put the filler pieces back in, and they can do a filling on the top. And then now that tooth is ready for a crown.
Before you switch to the next slide, can I bother you real quick?
Yeah, please. Yeah.
Okay, so a lot of the times when we experience infections in our body, we'll be prescribed like antibiotics or something, and it'll go away essentially, or we'll kind of forget about it. Is that not the same case with your teeth?
That's a really good question. So here's the problem. Okay. The body can take care of things when they can get all the macrophages and the immune cells, into the area to fight the infection. But when a tooth becomes infected enough, and especially if like all the nerve tissue and the blood vessel tissue is killed by bacteria, all the bacteria gets trapped inside of the tooth. Okay, so there's no longer any circulation inside of it. It's physically trapped in a space, and it can hide. And all the bacteria creating condos and retirement homes, and having kids and grandkids, and they're like really, creating biofilm communities that can be really tough to get rid of. And so when that happens, we have to physically go into the tooth and clean it out and disinfect it. So that's the whole point of doing this procedure, is to reduce the bacterial bioload enough so that the body's immune response can then start the process of healing.
I see. Okay. Is this process almost kind of like mummifying a tooth?
Yeah, because it's really kind of impossible to say that we get all the bacteria out. So in a lot of cases you don't exactly know if there's zero bacteria left. All you're doing is just cleaning it out as best you can. And so when you seal everything up, you are kind of mummifying the inside of the tooth, and any bacteria that's left, they're just kind of entombed in the little tubes that make up the walls of the tooth. You're cutting off their food supply, and then hopefully they kind of stop multiplying and they're no longer a problem.
Okay, thank you.
Yeah. So root canal retreatments are unfortunately necessary quite often as well. Usually root canal treatment has a really high success rate if it's done properly and done well. It can be a pretty predictable treatment, but there are always certain cases that don't respond how we want it to, or maybe they weren't quite done, as ideally as possible the first time. And so they can be either infections that never clear up from the first root canal, or maybe become reinfected. Okay, so sometimes root canals do need to be redone, and this is an example of a root canal retreatment that I did. So the upper left picture was the initial root canal. There was still infection around the roots, and so what you have to do is remove all of the material, re-disinfect the roots from the inside, refit some filling material, and then reseal everything back up. And this is just some pictures of me kind of accessing the tooth. And then it actually had a canal that wasn't fully cleaned out from the first time. And then the upper right and the lower left pictures are, after I'd resealed and packed everything. Another procedure that endodontists do are called apicoectomies. And let's say, root canal's been done and it's also been redone. And then, well, what do you do if it doesn't heal? Well, sometimes you actually have to go in and physically remove the end of the root, the very tip of the infected root. And so in this case, this isn't a surgery I did, to be honest with you. I just got this from online, but you can see there's a little incision in the gums around this tooth, and you kind of have to flap them back. Then you create a little access window, okay, and then you use some high-speed burrs, and you physically cut off the end of the root of the infected tooth. And then you clean everything up, you reseal the end of the root, and then you put the gums back and do some little sutures. And so this can't be done for every case. There's only, if it's in the very back of the mouth, this procedure usually cannot be done. But it can be a great way of teeth that just for whatever reason have a type of bacteria that's really resistant and not allowing the body to heal.
Does this procedure manage to save the tooth for a longer period of time? Does it is the longevity of it? Does it last a while, or do a lot of patients do you get this procedure done on a frequent basis? Is this seen a lot?
It's not as common as doing initial root canals and retreating root canals. And to be honest with you, long-term success is actually comparable when it is done properly. But also, you have to remember, like, whenever we see teeth, it's because they've already gone through a lot. They've gone through a lot of like cavities or cracks or like reinfections underneath crowns. I mean, when we get them, usually a lot has already happened to the tooth. And apicoectomy is kind of a very last resort, to try to get something to heal before the tooth. It's kind of the end of the road. If this doesn't work out, usually the tooth's going to need to be extracted. So it's not the most common procedure. I don't do them too much at all. And my boss, the gentleman that I work for, he maybe does one every couple weeks.
Okay.
But it's not really something that you do every day, typically.
Yeah. Okay.
Another thing we do is sometimes a tooth can be saved without having to remove all of the nerve tissue, especially for kids. If they have a really big cavity, but the tooth is responding normally, for example, it might be a good option to just clean things up and put a little bit of material on top of the nerve to kind of help it calm down, and then do a filling on top of that. And we call that vital pulp therapy. This was an example where the roots of this specific tooth that I treated, they were wrapped entirely around the main nerve that runs through the jaw. And there's just no way that I was going to be able to try to do the root canal safely. And so what I did was just remove some of the nerve tissue in the middle of the tooth, but then it was actually healthy nerve tissue in the roots. And so I just did what we call vital pulp therapy, pulpotomy, just removed the tissue from inside the chamber and then placed a little bit of calcium silicate material on top of the rest of the roots, and then did a couple different filling materials to create a good seal on the top. And then I called her, the next day, and she was feeling fine. So this is one that it was actually a higher risk of trying to do the root canal, so we opted not to do the entire root canal. It sounded like it was working for her, so that was good. Another thing is, if someone undergoes a lot of traumatic episode with their teeth, maybe teeth are knocked out or pushed deep into the jawbone or something like that, a lot of the time that will damage the nerve that goes into the tooth enough that the tooth will need root canals. And this was a case that I saw actually when I was a general dentist. And this gentleman got into a bar fight, and he had someone swing and hit him, and he literally knocked 3 or 4 of his front teeth out. It looks like he knocked out 3 of his front teeth. And luckily they had put them in milk, and that's a pretty good medium to actually put teeth into that have fallen out just temporarily. And I put them back in as best I could, and then did some lingual braces on the backside of his teeth so that it would look okay, and then ended up needing to do the root canals. And I actually don't know what happened to him, but that was just what I did with the time that I had.
And then
yes, ma'am.
Really quick, there was a question that we got in the chat that's asking, on average, how long does the root canal procedure take with patients?
So when you're a dental student, it may take multiple appointments of 4 hours each.
Oh God.
Okay, I mean, I'm just kind of making a little bit of a joke, but in the real world, for an endodontist that does this all the time, like all day, every work day, we usually will block patients off for an hour and a half treatment, and usually the actual treatment time will be maybe 45 minutes or 1 hour.
Okay.
Yeah. Good question. Last thing that we do is regenerative endodontics. What that means is sometimes we can attempt to help the body grow back a little bit of tissue into a root. There's a lot of research being done right now with stem cell therapy. This case that I'm showing right here, it's not technically a regenerative endodontics case, but I actually haven't done one, if I'm being completely honest. But this is one where I didn't actually do the entire root canal. Then that very bottom right x-ray, you can see kind of a space at the very end of the tooth that I was treating. And what we're just attempting to do is, maybe this was a really young kid. It's a procedure used to try to get the root to grow thicker and actually give a little more strength to the tooth in the future. So that's kind of, I guess you could consider that, growing the root thickness of the tooth a little bit. But just for your information, there is regenerative endodontic procedures that are sometimes done as well.
Do you work with a pediatric population at all with your endodontic practice, or was this more seen in your general practice?
So there are several pediatric dentists that refer to the office that I work at. There are certain endodontists that work a lot more with kids. I would say, the practice that I work in, we don't really see a whole lot. A lot of the time with kids, especially with baby teeth, you don't really do quote unquote full root canals on baby teeth. A lot of the time you just kind of get the tissue out from the very middle, and then you put a little filler kind of material down in there, and then they fall out within a couple of years. So it's not the most common. Like, I'm not really treating patients under 10 years old every week. It's more of a it's not the most common.
I get it. Okay.
Yeah. So kind of in this presentation, just kind of helping you visualize what a normal workday might look like for an endodontist. This is my practice that I work at. I am not the owner. I'm an associate endodontist, so I'm hired. You get paid on kind of what you produce, so it's not like you just get a base salary. It's a production-based model. But this is a couple pictures from the office, and you can see the bottom center photo. This is a microscope that we work in, and the bottom left picture is the sterilization area. Then we also use something that I'll talk about just a little bit later called the GenoWave, and that's a technology that we use to disinfect the inside of teeth. And so I practice in Birmingham, Alabama, and I've been here from after I finished residency in 2020. Here is our staff, and the doctor that I work for, his name is Dr. James Smith. Really super nice guy. I'm very honored to work with him. And then on the lower left, we have Maya and Jan and Katrina as the office manager, and Lily and Miss Lisa, and then Dr. Smith. And all of the staff are cross-trained. They can all kind of fill in for each other as needed. There's no one that's just exclusively in the front desk or exclusively in the back. So it's really a great office to work in. And just as an example of kind of the types of schedule that I might have, this is a very average schedule. Just so you know, this is not showing any personal information for any patients. The names you see are referring doctors. But usually I'll treat between 4 or 5 patients for actual treatment. That means doing 4 or 5 root canals typically. And then sometimes there'll be 2 to 4 consults as well, just to kind of see somebody if they have something they're worried about and maybe need to get scheduled for treatment. Here are some more pictures. So in this left picture, you can see that's the microscope. And then on the very far right, this is a cart that has most of the hand pieces that I need to use to do a root canal. And then the bottom center photo is the assistant cart. And so they have a lot of materials, a lot of drawers and everything. And they actually have some optics that are also attached to the microscope. So when I bring it over top of the patient, they can actually look and see exactly kind of what I'm seeing as well. And that helps them stay engaged with the case and be able to predict what I need to work with. And I'm just going to go ahead, and I think this is getting closer towards the end of the presentation, but I wanted to just let any viewers know, I mean, there's some really exciting technology that is a part of the specialty, and there's a lot of things kind of up and coming and like really changing the way that root canals can be done. And one thing that we're really proud to use in our office is something called the GenoWave. And so before I kind of talk about what that is, I just want to explain traditionally the way that teeth are disinfected is with just a syringe. Okay, so when you open up the roots of the tooth and you get as much tissue out as you can, and you kind of you measure how long the roots are, and you open up the roots a little bit with some instruments, then the tooth is typically disinfected with just a syringe that has some irrigation in it. Usually that solution to irrigate the tooth out is sodium hypochlorite, which is a fancy word for bleach, okay? Because it kills bacteria really well. But there's some problems with using a syringe, and there's a company that kind of came up with a pretty ingenious solution to help with some of those problems. And what it is, it's this unit, you can see it all the way on the left, and it has a hose that comes off of it, and it has a handpiece that attaches to that hose. And you can see the handpiece right here in the center graphic. And then the bottom graphics show it's like this blue material that you squirt around the tooth, and you use a light to get it all hard, and it creates a platform that seals the top of the tooth up. And then you put the handpiece on top of that blue platform, and you just push the foot pedal, and this device, it cycles a lot of multisonically energized fluid, essentially 3% sodium hypochlorite, and then another one that can kind of decalcify the inside of teeth. And it cycles those, and it uses a whole lot more cleaning solution compared to what's usually used. And it gets into a lot of like the little spaces that we just haven't been able to get into traditionally. And it takes about 8 to 9 minutes, and then once it's done, you look down through the microscope in the tooth, and it's like the cleanest thing you've ever seen. And it really helps with cases, and it's pretty cool technology. So I just wanted to kind of show you, there's some cool things that are up and coming. Some some endodontists use lasers to activate cleaning solution. And there's a lot of other things kind of coming onto the market, but this is something that I think is really exciting, and it's almost kind of changing the way root canals are done right now.
I always love new technology. It's always so cool how they come up with it.
I know. I love it. I mean, this is just right here. This is an example of kind of what it allows to do. So we can disinfect the inside of teeth so much better while keeping the little shapes that we have to do in order to open up the root spaces. We can keep them smaller. Okay, so it's like better cleaning. Like you don't have to remove quite as much of the root tooth structure in order to get the job done. So this lower left picture, I didn't do the root canal, and I'm not trying to say this is a bad root canal, because it actually technically it's done all the way to the very end of the roots, and if it's lasting the patient, then that's a great treatment. But if you compare and you look at the white space inside of the tooth on the left, and you compare it to the tooth on the right, which is one that I did do, you can see the access opening on the very top of the tooth is so much bigger on the left, right? Like that tooth is going to be a lot weaker And the roots, the big like shapes going down into the roots of the tooth, that's going to cause the tooth to be a little more prone to fracture. And so it's, our whole job is trying to help patients save teeth. And if we can do our job by helping keep teeth stronger, that only benefits the patient. So that's just kind of one benefit about it.
Oh, it makes sense. Yeah.
Yeah. So kind of to end everything up, if you're listening to this point, well, God bless you, because you're kind of a nerd, maybe like the rest of us. But I hope you can better visualize what the specialty involves and what a regular day looks like as an endodontist. And I like to think that endodontists are superheroes of dentistry, because what we're doing, our job is to relieve patients' pain and save their teeth if they want that done, and if the tooth can be saved. And lastly, there's some really cool, exciting technology in our specialty, and it's only going to keep getting better and improving. And so there's never been a better time to be interested in endodontics.
All right. Okay, so we do have a couple of questions that I missed earlier from earlier parts of your presentation. So if you wouldn't mind, we could just kind of scroll through them too.
Sure.
All right, so the first question I have is, so they're saying about their gap year, they wanted to do the same things and explore different things and travel just like you did before dental school. And they wanted to know that if that's okay to share with dental school interviews.
I think so. I mean, especially if you are actually using it to benefit yourself as a candidate. Like, for example, I actually was able to use that time to continue to explore, different aspects of dentistry that I didn't actually know about. And so if you use the time to only benefit, your application, I think that'd be great. I think it can be beneficial if you decide to do that. Let's say you take the DAT your third year and it's like you didn't get the score you were hoping for. Well, you can plan to just do a gap year and, then use a whole nother year as a preparation time to, get to the place where you feel you need to be. So even if you take a gap year, I don't think you necessarily have to talk about it during your interview process. I don't think it's a deterrent. That's the best answer I have. I think it was beneficial for me because I studied so hard in college that it actually kind of like helped me be ready to do some more hard studying. Because if I'm being honest, the academic process of dental school was a lot harder than college, and so you do want to be ready for that.
Yeah. So we've heard that it's harder.
Yeah, it is. The first 2 years especially.
Okay, and then the next question we have was, during residency, do we get paid?
Yeah, that's a good question. There are some residencies that do pay, but the majority for endodontics do not. I would say the majority of most dental specialties do not. So that's different than medical residencies. Most of them get some kind of salary, but I had to take out loans in order to live and be able to pay for tuition. And so, yeah, I would say don't expect to be paid, but there are some that do, and they're pretty competitive and highly desirable because of that.
All right, and then just to start ending things off, what does your work-life balance look like right now that you're an associate and you're working, you've been out of school for a while, and your loans?
Yeah. So I work 4 days a week. I started off working 4.5 days, and then I just like working 4. And so I like that's pretty common in dentistry. I usually will start a day at 7:45. I'll go in around 7:30 and then start treating patients at 7:45. And usually I'm done at 5 p.m., if not a little bit before. There's some days where it's later. Of course, in endodontics especially, we're kind of, my boss describes it as like a dental emergency room. So, I mean, if a patient is really in pain really needs to be seen because they're just like dying and really hurting with pain.
Mhm.
We really try to accommodate that, and sometimes there are later days, but on average, it's usually about 7:45 to 4:45.
That sounds really good. Okay.
Yeah,
Sounds good in my book.
yeah, yeah.
Okay. I actually think that our time is up now. It's been almost an hour, I think. But thank you so much, Dr. Adams, for your presentation. It was truly so informative for me, and I enjoyed going through with it and discussing with you everything that was happening. It was really fun, and I loved it.
Thank you so much. Thank you all for tuning in. And
Yeah.
if I can ever answer any questions, my email is the letters mdadds17@gmail.com. And I also can be found on Instagram at Dr. _ Michael Adams.
All right. Thank you so much, Dr. Adams. It was a pleasure to spend the evening with you like this.